There's a statue in New York City honoring a man who operated on women without anesthesia, over and over again, the same women, dozens of times. And for over 100 years, they called him the father of modern gynecology. But nobody talked about the 3 enslaved women he tortured to get there. His name was James Marion Sims, and if you went to medical school, you probably learned about him as a hero, a genius, a pioneer who saved countless women's lives. But here's what they don't teach you. Every single one of his breakthroughs came from experiments he did on enslaved black women who couldn't say no, women who had no choice, women whose names were almost erased from history. Today, we're going to talk about the real story behind one of medicine's most celebrated figures, and I'm warning you right now, this is going to make you angry. Here's the thing that's really messed up about this story. It's not just about one racist doctor from the 1800s. It's about how we celebrate people without asking the right questions. It's about how history gets written by the winners. And it's about how the medical system built its foundation on the bodies of people who had no power to refuse. James Marion Sims is still called the father of gynecology in textbooks. There are hospitals named after him. Medical schools teach his techniques. Until recently, there was a statue of him in Central Park in New York City. Think about that, a statue in one of the most famous parks in the world, celebrating a man who did things that would get you arrested today. But before we get into what he did, we need to understand who he was and how he got away with it. Because this isn't just a story about one bad person. This is a story about a system that allowed it to happen, a system that encouraged it, a system that rewarded it. And here's what should really bother you. The same attitudes that let Sims torture enslaved women didn't just disappear. They evolved, they changed shape, but they never really went away. And we're going to talk about that too. James Marion Sims was born in 1813 in South Carolina. His dad wanted him to be a lawyer, but Sims wasn't really into it. He failed at pretty much everything he tried. Seriously, this guy was not some natural-born genius. He was just a regular dude who kept messing up. He eventually decided to become a doctor, but here's the funny part. Well, not funny, more like ironic. Sims actually hated being around sick people. He said so himself. He couldn't stand the sight of blood. He got nervous around patients. This is the guy who's supposed to be a medical hero. After medical school, Sims moved to Alabama and set up a practice. And he was not good at it. He had no idea what he was doing most of the time. He tried treating people with the limited knowledge he had, but a lot of his patients died. One time, he tried to cure a baby's crossed eyes by moving the bones in the skull. The baby died. Another time, he operated on a baby's jaw. That baby died too. But Sims kept going. And here's where the story gets dark, really dark. In the South, during the 1840s, enslaved people were property. That's not an exaggeration or a figure of speech. In the eyes of the law, enslaved people were literally objects that could be bought and sold. And if you owned property, you could do whatever you wanted with it. Plantation owners would sometimes call doctors to treat their enslaved workers, not because they cared about these people as human beings, but because enslaved people were expensive. If someone you paid money for got sick or injured, you wanted them fixed so they could get back to work. It's disgusting, but that's how they thought. Sims started getting called to plantations to treat enslaved women who had birth injuries, and this is where everything changed. Okay, so we need to talk about vesicovaginal fistulas. I know that sounds complicated, but stay with me because this is important. A vesicovaginal fistula is basically a hole that forms between the bladder and the vagina. It usually happens during childbirth when labor goes on too long and the baby gets stuck. The pressure cuts off blood flow to the tissue and that tissue dies. When it dies, it creates a hole. When you have this hole, you can't control your urine. It just leaks out constantly. You can't stop it. You smell like urine all the time. Your skin gets irritated and infected. You're in pain constantly. And in the 1840s, there was no treatment for it. If you got a fistula, you had it for life. For enslaved women who developed fistulas, it made their already horrible lives even worse. They couldn't work as hard because they were in constant pain. They were isolated from other enslaved people because of the smell, and their owners saw them as damaged property. This is what Sims decided to focus on. And on the surface, that sounds noble, right? He wanted to help women who were suffering from this terrible condition. But here's what you need to understand. Sims didn't care about these women as people. He saw them as opportunities, as test subjects, as bodies he could use to figure things out. Let me tell you about 3 women. Their names were ANARCHA, BETSEY, and Lucy. For a long time, these names were barely mentioned in medical history. But without them, Marion Sims would have been nobody. ANARCHA was 17 years old when Sims first saw her. 17. She had been in labor for 3 days, 3 entire days of agony before the baby finally came. But the baby died, and ANARCHA was left with a severe fistula. Her owner brought her to Sims, and Sims saw her suffering as an opportunity. Betsy and Lucy had similar stories. Young women who had difficult births that left them with fistulas. Young women who were in constant pain. Young women who had no say in what happened to their bodies. Sims convinced the owners of these women to let him try to fix the fistulas. But here's the thing. He had no idea how to do it. Nobody did. There was no established procedure, no textbook to follow. He was going to figure it out by experimenting on them. And that's exactly what he did. In 1845, Sims built a small hospital in his backyard in Montgomery, Alabama. It was basically a shed where he could do his experiments away from the public eye. He brought ANARCHA, Betsy, and Lucy to live there, along with several other enslaved women who had fistulas. Then he started operating. Here's what you need to know about surgery in the 1840s. Anesthesia existed, but it was new and not commonly used. When it was used, it was usually reserved for white patients. Sims had access to ether, which could knock people out during surgery. But he chose not to use it on these women. Why? Sims claimed it was because anesthesia was dangerous, and he didn't want to risk their lives. But that's nonsense. He was already cutting into them repeatedly. The real reason is that he didn't think he needed to. He believed that black people didn't feel pain the same way white people did. This wasn't just Sims being evil. This was a widespread belief in medicine at the time. Doctors and scientists genuinely believed that black people had thicker skin, different nerve endings, higher pain tolerance. It was complete garbage, but it was taught in medical schools, it was written in textbooks, it was used to justify all kinds of horrible things. So Sims operated on these women while they were fully awake and aware of everything that was happening. Think about that for a second. Imagine being held down on a table while someone cuts into you, while you feel every single thing, while you scream and beg them to stop, and they just keep going because they don't believe you're really feeling it. That's what happened to ANARCHA, Betsy, and Lucy over and over and over again. The first surgery on ANARCHA failed. Sims tried to close the hole in her bladder, but it didn't work, so he tried again and again and again. He operated on ANARCHA 30 times, 30. Each time without anesthesia. Each time hoping this would be the one that worked. Each time failing and deciding to try again. Betsy and Lucy went through the same thing, multiple surgeries, all without pain relief, all while fully conscious. The recovery period between surgeries was its own kind of torture. The women had to lie still for weeks to let the wounds heal. They were in constant pain. They developed infections. They had to deal with the shame and humiliation of their condition. And through all of this, they had no choice. They couldn't say no. They couldn't leave. They were property, and Sims could do whatever he wanted to them. Other doctors heard about what Sims was doing and came to watch. They stood around these women like they were watching a show, a demonstration. Nobody questioned whether this was okay. Nobody asked if the women had agreed to this, because in their minds, enslaved people couldn't consent anyway. Their owners had already consented for them. Sims kept detailed notes about his experiments. He wrote about the techniques he tried, the tools he invented, the different approaches he experimented with. But in his notes, ANARCHA, BETSEY, and Lucy weren't really people. They were cases, examples, test subjects. He invented new surgical instruments during this time. The most famous one is called the Sims speculum. It's still used today, though the design has been modified. He also developed a specific position for gynecological exams called the Sims position. These innovations came directly from his work on enslaved women. After 4 years of experiments, Sims finally figured out how to successfully repair a vesicovaginal fistula. The technique involved using silver wire sutures and a specific way of positioning the patient. It worked on ANARCHA after her 30th surgery. 30 surgeries to get it right. Once Sims figured out the procedure, he started performing it on white women. But here's the difference. When he operated on white women, he used anesthesia every single time. Because apparently, when it came to white women, anesthesia wasn't too dangerous anymore. He moved to New York City in 1853 and quickly became famous. He opened the first hospital in America specifically for women's health issues. He operated on rich women from all over the world. He became the personal physician to European royalty. He made a fortune. Medical journals praised him as a genius. Other doctors wanted to learn his technique. He was invited to speak at conferences and medical schools. He wrote papers that were published and read by doctors everywhere. And in all of this success, in all of these papers and speeches and accolades, he barely mentioned ANARCHA, BETSEY, and Lucy. When he did mention them, it was only in passing, just as examples of cases he had worked on, not as human beings who had suffered through years of experimental surgeries without anesthesia. Sims knew exactly what he had done. He knew these women had no choice. He knew they suffered. But in his mind, it was worth it. The end justified the means. He had made an important medical breakthrough, and that was what mattered. This is how he was remembered for over 150 years, as a hero, as a pioneer, as the father of modern gynecology. Statues were built, hospitals were named after him. Medical students learned about his genius and innovation. And almost nobody talked about ANARCHA, BETSEY, and Lucy. Here's what makes this story even worse. Sims wasn't an outlier. He wasn't some uniquely evil person doing things that other doctors would have been horrified by. He was just one example of a much bigger problem. The entire medical field in America was built on the bodies of Black people who couldn't say no. Medical schools in the South regularly used the bodies of enslaved people for dissection and anatomy lessons. Grave robbers would dig up bodies from Black cemeteries to sell to medical schools. Doctors would practice new surgical techniques on enslaved people before trying them on white patients. There are records of doctors buying enslaved people specifically to use for experiments. They would keep them in hospitals or private facilities, try out different treatments and procedures, and document what happened. If the person died, well, that was just the cost of medical progress. And it wasn't just surgery. Researchers did all kinds of experiments. They tested how much heat people could tolerate by putting them in hot boxes. They tested medications to see what the side effects were. They deliberately infected people with diseases to study the progression. This wasn't secret or hidden. Doctors wrote about it in medical journals. They discussed it at conferences. It was considered normal and acceptable because the people being experimented on were considered less than human. The belief that Black people didn't feel pain the same way white people did lasted well into the 20th century. Even after slavery ended, this idea persisted. Doctors would give less pain medication to Black patients. They would assume Black patients were exaggerating their pain. They would perform procedures without adequate anesthesia. And you know what? This attitude still exists today. Studies have shown that Black patients are less likely to receive pain medication than white patients with the same injuries. They're more likely to have their pain dismissed. They're more likely to receive inadequate treatment. Medical students today are still less likely to believe Black patients when they describe their pain. Not because they're actively trying to be racist, but because of unconscious biases that have been baked into the system for centuries. The legacy of James Marion Sims isn't just about what he did in the 1840s. It's about the attitudes and beliefs that allowed him to do it. And those attitudes and beliefs are still affecting people today. For most of history, when people told the story of James Marion Sims, they focused on his achievements. The fistula repair technique, the surgical instruments, the hospital he founded, his contributions to women's health. ANARCHA, BETSEY, and Lucy were footnotes if they were mentioned at all. Sometimes they weren't even named. They were just described as enslaved women who participated in Sims's experiments. Participated? Like they had a choice? We know very little about these women's lives beyond their connection to Sims. We don't know what happened to them after the experiments ended. We don't know if they had families. We don't know if they survived the Civil War. We don't know when they died or where they're buried. Their stories were considered unimportant, not worth recording, not worth remembering. This is what happens when history is written by the people in power. The experiences of the powerless get erased. Their suffering gets minimized or ignored. And the people who caused that suffering get celebrated. It wasn't until the late 20th century that historians and medical ethicists started really looking at Sims's story with a critical eye. They started asking questions that should have been asked from the beginning. Questions like, did these women consent? Did they have any choice? How much did they suffer? Why is that suffering never mentioned when we talk about Sims's achievements? Academics started writing papers about the ethical problems with Sims's experiments. They started trying to find more information about ANARCHA, BETSEY, and Lucy. They started arguing that Sims shouldn't be celebrated without acknowledging what he did to get his results. But even then, the medical establishment was slow to respond. Textbooks kept calling him the father of gynecology without mentioning the enslaved women. Hospitals kept his name on their buildings. The statue in Central Park stayed up. It took a long time for things to start changing, and honestly, the change is still happening right now. In 2017, there was a big debate about Confederate statues and monuments in America. Cities were deciding whether to take down statues of Confederate generals and leaders. And during this debate, someone pointed out that there was a statue of James Marion Sims in Central Park. This started a whole conversation about whether that statue should stay up, and people had very strong opinions on both sides. Some people argued that Sims made important contributions to medicine and deserved to be honored for that. They said you can't judge historical figures by modern standards. They said that removing the statue was erasing history. Other people argued that you can't separate Sims's achievements from how he got them. They said that honoring him with a statue was a slap in the face to Black women. They said that the statue represented the ongoing problem of medical racism. The debate went on for months. There were protests, there were counter-protests. People wrote articles and gave speeches and argued on social media. Finally, in 2018, New York City decided to remove the statue from Central Park. They moved it to a cemetery in Brooklyn where Sims is buried. The decision was made with the understanding that Sims's legacy is complicated and that his contributions to medicine can't be separated from the suffering he caused. But this wasn't the end of the conversation. It was just the beginning. Medical schools started reviewing their curricula. Some decided to stop calling Sims the father of gynecology. Some added information about ANARCHA, BETSEY, and Lucy to their lessons. Some started teaching about the broader history of medical racism and exploitation. Hospitals started reconsidering whether they wanted Sims's name on their buildings. Some changed their names. Some added plaques acknowledging the problematic aspects of his legacy. And historians started working to uncover more information about the women who were experimented on. They searched through old records and documents. They tried to piece together what happened to these women and honor their experiences. This work is ongoing. We're still learning. We're still having these conversations. We're still figuring out how to deal with this history. You might be wondering why we're spending so much time on something that happened almost 200 years ago. Why does this matter now? Why should you care about James Marion Sims and 3 women you'd never heard of before today? Here's why it matters. First, because the medical system still has a racism problem. Black women in America are 3 to 4 times more likely to die from pregnancy-related complications than white women. 3 to 4 times. In 2024, with all our modern medicine and technology, Black women are dying from childbirth at rates that are completely unacceptable. And it's not because Black women are inherently less healthy. Studies have shown that education level, income, and access to healthcare don't fully explain the disparity. Even rich, educated Black women have worse outcomes than poor white women in some cases. The problem is that Black women's pain and concerns are taken less seriously. They're more likely to have their symptoms dismissed. They're more likely to have complications missed or ignored. They're more likely to receive inadequate care. This is a direct result of the same attitudes that let James Marion Sims torture enslaved women without anesthesia. The belief that Black people don't feel pain the same way. The belief that Black patients are exaggerating. The belief that Black bodies are somehow different and require different standards of care. These beliefs are still in the medical system. They're in the unconscious biases of doctors and nurses. They're in the way medical research is conducted. They're in the way pain is assessed and treated. Second, this matters because it shows how history gets whitewashed. For over 100 years, James Marion Sims was presented as an unambiguous hero. The negative parts of his story were left out or minimized. And this happens with a lot of historical figures. We're taught about the Founding Fathers without fully confronting their relationship with slavery. We're taught about westward expansion without fully confronting what that meant for Native Americans. We're taught about scientific progress without fully confronting how much of that progress came at the expense of people who had no power to refuse. When we don't tell the full story, we can't learn the full lessons. We can't understand how we got to where we are. We can't fix problems that we don't acknowledge exist. Third, this matters because ANARCHA, BETSEY, and Lucy deserve to be remembered. They suffered. They endured. They contributed to medical knowledge whether they wanted to or not, and their names should be known. For too long, history has been written as if they don't matter, as if their experiences are less important than Sims' achievements, as if their pain is just an unfortunate footnote to a story of medical progress. But they do matter. Their stories matter, and we have a responsibility to tell those stories honestly. Let's talk about something that makes people uncomfortable. If the medical knowledge Sims gained came from unethical experiments, should we still use that knowledge? This is a real question that medical ethicists debate. On one hand, the knowledge exists. The surgical technique works. Women today benefit from procedures that were developed through Sims' work. Should we throw away knowledge that can help people just because of how it was obtained? On the other hand, using that knowledge without acknowledging where it came from feels wrong. It feels like we're benefiting from suffering without taking responsibility for it. It feels like we're saying that the ends justified the means. There's no easy answer to this, but here's what most ethicists agree on. We can use the knowledge, but we have to acknowledge the full history. We have to teach medical students about ANARCHA, BETSEY, and Lucy. We have to be honest about how this knowledge was obtained. We have to recognize that medical progress came at an unacceptable human cost. We also have to commit to never letting it happen again. We have to have strict rules about informed consent. We have to protect vulnerable populations from exploitation. We have to make sure that medical research is conducted ethically. And we have to acknowledge that the harm done to ANARCHA, Betsey, and Lucy can never be undone. No amount of medical progress makes up for what they went through. Their suffering wasn't worth it, even if it led to important discoveries. This is uncomfortable to think about. It's easier to just focus on the positive outcomes and ignore the negative parts. But that's not honest. And if we're not honest about history, we're doomed to repeat it. James Marion Sims isn't the only example of medical advancement built on exploitation. There are so many other cases that most people don't know about. There's the Tuskegee syphilis study, where the U.S. government studied the progression of untreated syphilis in black men for 40 years. The men were told they were being treated, but they weren't. They were just being observed to see what would happen as the disease progressed. Many of them died. Many of them infected their wives and children. And the whole time, doctors were just taking notes. There's Henrietta Lacks, a black woman whose cancer cells were taken without her knowledge or consent in 1951. Those cells, called HeLa cells, have been used in countless medical experiments and have led to major breakthroughs. But Henrietta's family didn't know about it for decades. They didn't get any compensation, they didn't get any say in how her cells were used. There's the forced sterilization of black women, Native American women, and Puerto Rican women that continued well into the 1970s. Doctors would sterilize women without their full informed consent. Sometimes they would do it without telling them at all. They believed they were preventing these women from having children who would be a burden on society. There's J. Marion Sims's contemporary, Dr. Thomas Hamilton, who conducted pain experiments on enslaved people in Georgia. He would test how much heat people could tolerate. He would blister their skin and muscles to study the healing process. He published his findings in medical journals and was respected in his field. There's Dr. Walter Freeman, who popularized the lobotomy in the 1940s and 50s. He performed lobotomies on over 3,000 people, many of them against their will. He experimented with the procedure, trying different approaches to see what would happen. Many of his patients were left severely disabled or died. The history of medicine is full of stories like this. Stories of people who were used as test subjects without their consent. Stories of suffering that was justified in the name of progress. Stories that we don't like to talk about because they make us uncomfortable. But we need to talk about them, because if we don't learn from these stories, we risk repeating them. When we call someone the father of a field, we're saying they're the founder, the pioneer, the person who made it possible for everyone else. And that comes with a lot of respect and honor. But what do we do when the father of a field did horrible things? When their achievements are inseparable from exploitation and suffering? Some people argue we should stop using these titles altogether. Instead of calling Sims the father of gynecology, we should just acknowledge that he developed certain procedures. We can recognize his technical contributions without honoring him as a person. Other people argue we should replace these titles. Instead of focusing on Sims, we should recognize the contributions of ethical doctors who advanced the field in moral ways. We should lift up the people who made progress without causing harm. And some people argue we should keep the titles, but add context. Keep calling Sims the father of gynecology, but always include the full story. Always mention ANARCHA, Betsey, and Lucy. Always acknowledge the exploitation. Personally, I think the first or second option makes the most sense. Why do we need to honor someone as the father of anything? Why can't we just say they developed a technique? Why does it have to be a title that implies respect and admiration? But I'm not a doctor or a historian, so my opinion doesn't matter as much as the people who are actively working in this field and studying this history. What matters is that we're having the conversation. We're questioning these titles instead of just accepting them. This is the part that makes me the angriest. We spent all this time talking about James Marion Sims. We know where he was born, where he studied, where he worked, where he died, where he's buried. We know about his wife and children. We know about his career and his achievements. But we barely know anything about ANARCHA, Betsey, and Lucy. We don't know ANARCHA's last name. We don't know where she was born. We don't know if she had children. We don't know if she was ever freed. We don't know when she died. Same with Betsy and Lucy. We have their first names because Sims mentioned them in his writings, but that's about it. Everything else about their lives has been lost or was never recorded in the first place. This is what happens when people are considered property instead of human beings. Their stories don't get preserved. Their experiences don't get documented. They become invisible. Historians have tried to find more information about these women. They've searched through plantation records, census data, hospital records, anything that might give us more details. But enslaved people often weren't recorded in detail. If they were mentioned at all, it was usually just a first name and maybe an age. Some historians think that ANARCHA might have lived long enough to see the end of slavery. The timeline would make it possible, but we don't know for sure. We don't know if she ever had the chance to live as a free woman. We don't know if she ever got to make her own choices about her body and her life. This loss of history isn't an accident. It's a result of a system that didn't value these women's lives. A system that saw them as tools to be used and then forgotten. A system that cared more about the achievements of the doctor than the suffering of the patients. And that system is what we're still fighting against today. Modern gynecology has come a long way since the 1840s. We have better tools, better techniques, better understanding of women's health. We have anesthesia and antibiotics and all kinds of technology that didn't exist back then. But the field still has problems. For one thing, women's pain is still often dismissed or minimized. Studies have shown that women wait longer in emergency rooms than men with the same complaints. They're more likely to have their pain attributed to emotional or psychological causes. They're more likely to be told their symptoms are normal when they're not. This is especially true for Black women. The same biases that existed in Sims's time still show up in different forms today. Black women are less likely to be believed when they describe their pain. They're less likely to receive adequate treatment. They're more likely to have serious conditions missed or misdiagnosed. There's also the issue of medical research. For a long time, most medical studies were done on men. Drugs were tested on men. Procedures were developed with male bodies in mind. And then these treatments were used on women without considering that women's bodies might respond differently. This is starting to change, but slowly. There's more awareness now about the need to include women in medical research. There's more attention paid to conditions that primarily affect women, but we still have a long way to go. And then there's the question of consent and autonomy. Women today have much more control over their own medical care than they did in the past. But there are still fights about reproductive rights, about access to certain procedures, about who gets to make decisions about women's bodies. The legacy of James Marion Sims reminds us that these issues aren't new. The medical system has always had a complicated relationship with women's bodies, especially the bodies of women of color. And fixing these problems requires acknowledging that history and actively working to do better. There are people who think we should just move on from stories like this. They say it's all in the past. They say we can't change what happened, so why dwell on it? They say talking about these things just makes people feel bad and doesn't solve anything. But here's the thing. We can't fix problems we won't acknowledge. We can't do better if we don't understand what went wrong. And we can't honor the people who suffered if we erase their stories from history. Remembering ANARCHA, Betsy, and Lucy isn't about making people feel guilty. It's about telling the truth. It's about recognizing that medical progress came at a cost. And it's about making sure we don't repeat the mistakes of the past. When we talk about James Marion Sims, we have to talk about the full story. Not just the surgical technique he developed, but how he developed it. Not just his achievements, but what those achievements cost. Not just his name, but the names of the women he experimented on. This isn't about erasing history. It's about telling the complete history. It's about making sure that when we talk about medical pioneers, we also talk about the people whose bodies were used without consent to make that pioneering possible. And it's about recognizing that these aren't just stories from the past. The attitudes and beliefs that allowed Sims to torture enslaved women are still affecting healthcare today. The racism that let doctors believe Black people didn't feel pain is still showing up in how Black patients are treated. If we don't remember where these attitudes came from, we can't fight against them effectively. We can't create a better, more equitable healthcare system if we pretend the current system doesn't have deep roots in exploitation and racism. Over the past few years, there's been a growing movement to recognize and honor ANARCHA, BETSEY, and Lucy. Artists have created monuments to them. Writers have tried to tell their stories. Activists have pushed for their names to be included whenever Sims' work is discussed. In Montgomery, Alabama, where Sims did his experiments, there's now a memorial to the enslaved women he operated on. It's not as grand as the statue Sims used to have in Central Park, but it exists. It's a place where people can go to remember these women and acknowledge what they went through. Medical schools are starting to teach about this history more honestly. Instead of just presenting Sims as a hero, they're teaching students about the ethical problems with his work. They're using his story as a case study in why informed consent matters and why we need to be aware of bias in medicine. Some gynecology conferences have started including sessions about this history. They're talking about how to honor the contributions of women like ANARCHA while also making sure that modern gynecology is practiced ethically. And historians are continuing to search for more information about these women. They're trying to piece together their lives, to give them back some of the humanity that was stripped from them. This work matters. It matters because these women deserve to be remembered. It matters because their suffering was real and shouldn't be forgotten. And it matters because their story is part of a larger story about who gets to be considered human and whose pain matters. So, what are we supposed to take away from all of this? What's the point of learning about something so horrible that happened so long ago? First, we need to understand that progress isn't always clean. Medical advances, scientific breakthroughs, technological innovations, a lot of these things came at a cost. And often, that cost was paid by people who had no choice in the matter. This doesn't mean we should reject all medical knowledge or refuse to benefit from these advances. But it does mean we need to be honest about where they came from. We need to acknowledge the suffering that went into creating them. And we need to make sure we're not continuing to exploit vulnerable people in the name of progress. Second, we need to recognize that the people in power write the history. For over 100 years, the story of James Marion Sims was told by people who admired him. They focused on his achievements and ignored the exploitation. It's only recently that people have started telling the full story. This should make us skeptical of any historical narrative that seems too clean or too simple. We should always ask, whose perspective is this? Who benefits from this story being told this way? Whose experiences are being left out? Third, we need to understand that the problems of the past aren't really past. The racism that existed in medicine in the 1840s still exists today. It looks different, it's less obvious, but it's still there. Black women are still dying from pregnancy complications at higher rates. Black patients are still receiving inadequate pain treatment. Medical research still doesn't always include diverse populations. These are ongoing problems that require ongoing work to fix. And finally, we need to remember the names: ANARCHA, BETSEY, and Lucy. These three women whose suffering led to medical breakthroughs. These three women who had no choice. These three women who were almost erased from history. Their names should be known just as well as James Marion Sims's name. When we talk about the development of gynecology, we should mention them first, because without them, there would be no story to tell. What happened with James Marion Sims wasn't unique. It was part of a much larger pattern that existed throughout medical history and, in many ways, still exists today. Throughout the 19th and early 20th centuries, medical experimentation on vulnerable populations was common. And when I say vulnerable, I mean people who couldn't say no. people who didn't have power, people who were seen as less than fully human. This included enslaved people, obviously, but it also included prisoners, people in mental institutions, poor people in public hospitals, immigrants who didn't speak English, children in orphanages, and people with disabilities. Doctors and researchers saw these populations as opportunities. They could try out new procedures without risking the lives of paying patients. They could test medications without worrying about lawsuits. They could learn anatomy and surgical techniques without consequences. There's a story from the early 1900s about a doctor in New York who was trying to figure out how gonorrhea spread. So he deliberately infected children in an orphanage with the disease. Children. He infected them on purpose just to see what would happen. And this was published in a medical journal. Other doctors read about it and didn't see anything wrong with it. There's another story about a doctor in the 1950s who injected live cancer cells into patients at a hospital in Brooklyn. The patients were elderly and had chronic illnesses. They didn't know what was being injected into them. The doctor wanted to see if their bodies could fight off the cancer cells. Some of the patients developed tumors. These aren't isolated incidents. This was standard practice for a long time. The attitude was that medical progress was more important than the rights or welfare of individual people, especially if those people were already sick, poor, or marginalized. It wasn't until after World War II that this really started to change. The Nazi medical experiments during the Holocaust shocked the world. Doctors had done horrific things to concentration camp prisoners in the name of research. They had frozen people to death to study hypothermia. They had infected people with diseases. They had performed surgeries without anesthesia. After the war, there was a trial in Nuremberg specifically for the Nazi doctors. And out of that trial came something called the Nuremberg Code. This was a set of principles for ethical medical research. The first and most important principle was informed consent. Nobody should be experimented on without understanding what's happening and agreeing to it. This was revolutionary. For the first time, there was an international agreement that you couldn't just use people as test subjects without their permission. But here's the messed up part. Even after the Nuremberg Code, even after the world had supposedly learned its lesson, unethical medical experiments continued in America. The Tuskegee syphilis study started in 1932 but continued until 1972, 40 years after Nuremberg. The doctors involved knew they were withholding treatment from black men with syphilis just to study the disease progression. They knew it was wrong, but they did it anyway. The reason these things kept happening is that the medical establishment didn't really think the Nuremberg Code applied to them. They thought it was about preventing Nazi-level atrocities. They didn't think it meant they had to change how they did research in America. It took decades of activism, journalism, and public outrage before real protections were put in place, before informed consent became a legal requirement, before ethics committees started reviewing research proposals, before the rights of research subjects were taken seriously. And even now, even with all these protections, there are still problems. There are still cases where vulnerable populations are exploited. There are still researchers who cut corners or don't fully inform their subjects. There are still systemic inequalities in who gets to participate in research and who benefits from medical advances. The legacy of James Marion Sims and doctors like him isn't just historical, it's ongoing. There's another factor we need to talk about that made exploitation possible: money. Enslaved people were expensive. Plantation owners paid a lot of money for them. And like any investment, they wanted to maintain that investment. If an enslaved person got sick or injured, that represented a financial loss. This is why plantation owners would call doctors to treat enslaved workers, not out of compassion, but out of economic self-interest. They wanted their property functioning and productive. James Marion Sims understood this. When he offered to treat enslaved women with fistulas, he was offering to restore their economic value to their owners. He wasn't doing it for free. He was being paid by the plantation owners. And later, once he had perfected his technique, he made a fortune operating on wealthy white women. He charged high fees. He became rich and famous. His surgical innovations made him a lot of money. This capitalist logic has always been part of medicine in America. Healthcare is a business. Doctors and hospitals and pharmaceutical companies are trying to make money. And this financial motivation can lead to exploitation. We see this today in lots of ways. Clinical trials for new drugs are often conducted in poor countries where regulations are less strict, and people are desperate enough to participate for small payments. Pharmaceutical companies charge outrageous prices for life-saving medications because they know people will pay anything to survive. Hospitals in poor neighborhoods close down because they're not profitable, leaving those communities without adequate health care. The same logic that made enslaved people valuable to their owners makes poor and sick people valuable to the medical industry today. Not as human beings worthy of care, but as potential sources of profit. And just like in Sims's time, the people with the least power are the ones who get exploited. They're the ones who participate in risky clinical trials because they need the money. They're the ones who can't afford good health care. They're the ones who end up in understaffed, under-resourced facilities. This isn't to say that all doctors and healthcare workers are motivated purely by profit. Most people who go into medicine genuinely want to help people. But they're working within a system that prioritizes profit over people, and that system creates incentives for exploitation. Let's talk about what it must have been like for ANARCHA to go through 30 surgeries without anesthesia. The physical pain is almost unimaginable. Having someone cut into your body while you're fully awake and aware, feeling every slice of the scalpel, feeling your flesh being pulled and stitched, being in agony and having no way to make it stop. But the psychological trauma might be even worse. The helplessness, the fear, knowing that it's going to happen again and again and there's nothing you can do about it. After the first surgery failed, ANARCHA knew what was coming. She knew Sims would try again. She knew she would have to endure that pain again and again and again. 30 times. Can you imagine living with that knowledge? Can you imagine the dread she must have felt? Can you imagine how violated she must have felt, having no control over what was done to her? This is trauma on a level that most of us can't comprehend. And there was no therapy, no counseling, no support system to help her deal with it. She just had to survive it and keep going. And it wasn't just the surgeries. It was the recovery period between surgeries. The pain and infection, the inability to move, the constant medical observation, the lack of privacy or dignity. It was being treated like an object instead of a person, being discussed by doctors like she couldn't hear them, being poked and examined by medical students who came to watch, having her body be the subject of scientific curiosity instead of being seen as a human being. This kind of medical trauma still happens today, especially to women and especially to women of color. The feeling of not being listened to, the experience of having your pain dismissed, the violation of having procedures done to you without adequate explanation or consent. Studies have shown that women, particularly Black women, often avoid seeking medical care because of previous negative experiences. They've been traumatized by a healthcare system that doesn't take them seriously, that doesn't treat them with respect, that makes them feel like they don't have agency over their own bodies. This is part of Sims's legacy too. The trauma he inflicted on ANARCHA, Betsey, and Lucy is echoed in the experiences of women today who don't feel safe in medical settings, who don't trust doctors, who put off getting care because they're afraid of how they'll be treated. James Marion Sims didn't work in isolation. Other doctors knew what he was doing. They came to watch his surgeries. They read his papers. They learned his techniques. And none of them spoke up. Why? Because in their worldview, what Sims was doing wasn't wrong. Enslaved people were property. Using them for medical experiments was no different from using them for agricultural labor. It was just another use of a resource. This collective agreement, this shared assumption that certain people's bodies were available for use, is what made the exploitation possible. It wasn't just one evil doctor. It was an entire system that supported and encouraged what he was doing. And when Sims became famous, when he was celebrated as a medical pioneer, that system was validated. The message was clear. You can do whatever you want to powerless people, and as long as you achieve something impressive, you'll be rewarded for it. Other doctors saw this and learned from it. Not just the surgical techniques, but the underlying lesson about who matters and who doesn't. This culture of complicity still exists in medicine today. Doctors know about colleagues who are incompetent or unethical, but they don't report them. Hospitals know about problems with patient care, but they prioritize their reputation over fixing the problems. Researchers know that their studies don't include diverse populations, but they do them anyway because it's easier and cheaper.
This isn't to say that all doctors or all medical institutions are bad, but there is a culture of protecting the profession, of not speaking up, of going along with things even when they're wrong. And that culture has roots in the same system that allowed James Marion Sims to torture enslaved women for 4 years without anyone stopping him. Breaking this culture requires people within the medical profession to speak up, to call out racism and sexism and exploitation when they see it, to prioritize patient welfare over professional courtesy, to acknowledge when the system is failing and work to fix it. It's not easy. Speaking up can cost you your career, but staying silent costs people their lives and their well-being. For most of history, ANARCHA, BETSEY, and Lucy were nameless. They were just mentioned as case studies, if they were mentioned at all. Enslaved women who Sims operated on, nothing more specific than that. But names matter. Names give people identity and humanity. When we say ANARCHA's name, we're acknowledging that she was a real person, not just a medical case, not just a body that was used for experiments, a person with thoughts and feelings and experiences. This is why activists and historians have fought so hard to recover the names of enslaved people, to find them in records and documents, to say them out loud, to make sure they're remembered. It's also why we need to be suspicious when people's names are missing from history. When we hear about unnamed victims or nameless test subjects, the absence of names usually means someone didn't think those people were important enough to record. Someone didn't see them as fully human. In the context of James Marion Sims, saying the names ANARCHA, BETSEY, and Lucy is an act of resistance. It's pushing back against the erasure. It's insisting that these women mattered, and their experiences mattered, and their suffering mattered. And it's not just about the past, it's about the present and future too. When we make sure to name and honor the people who were exploited in the past, we're setting a standard for how we should treat people now. We're saying that everyone's name and story deserves to be known. If you're a doctor or nurse or anyone working in healthcare, this history is your responsibility to know and understand. Not because you personally did anything wrong, but because you're part of a profession that did. Medicine as a field has to reckon with its past. It has to acknowledge the racism and exploitation that are built into its foundation, and it has to actively work to do better. This means more than just learning about history. It means examining your own biases and assumptions. It means questioning practices and protocols that might be rooted in racist ideas. It means listening to patients, especially patients who have historically been dismissed and mistreated. It means being willing to admit when the medical system fails patients, being willing to advocate for change, even when it's uncomfortable or unpopular, being willing to speak up when you see colleagues treating patients unfairly. It also means actively working to make medicine more diverse and inclusive, supporting Black students in medical school, mentoring young doctors from underrepresented backgrounds, creating pathways for people who haven't traditionally had access to medical careers. And it means being honest with patients about the history of medicine. If you're a gynecologist, you should be able to talk about James Marion Sims and ANARCHA, BETSEY, and Lucy. You should be able to acknowledge that your field has a complicated and problematic history, and you should be able to explain how you're working to be different. This isn't about guilt or shame. It's about responsibility and accountability. It's about being part of the solution instead of perpetuating the problem. Even if you're not in the medical field, this history matters to you because it's part of the larger story of how our society treats different groups of people, and we all have a role to play in changing that. First, educate yourself. Learn about this history. Read books and articles about medical racism and exploitation. Listen to the stories of people who have been harmed by the healthcare system. Don't look away from the uncomfortable parts. Second, speak up. When you hear someone praising James Marion Sims without mentioning the full story, say something. When you see racism or bias in healthcare settings, call it out. When policies or practices perpetuate inequality, advocate for change. Third, support organizations working to address these issues. There are groups fighting for healthcare equity, for patients' rights, for medical ethics. They need funding and volunteers and public support. Fourth, and this might be the most important, listen to and believe people who talk about their experiences with medical racism. If a Black woman tells you that doctors don't take her pain seriously, believe her. Don't dismiss it, don't explain it away, just listen and support her. And fifth, remember the names. ANARCHA, BETSEY, Lucy. Say them. Share their stories. Make sure they're not forgotten.
These might seem like small things, but change happens through lots of people doing small things consistently, through refusing to accept the official narrative without question, through insisting that everyone's humanity be recognized and respected. So let's bring this all together. What's the big picture here? What does the story of James Marion Sims and ANARCHA, BETSEY, and Lucy really tell us? It tells us that medical progress has often come at a terrible human cost, that the bodies of powerless people have been used and exploited to benefit those with power, that racism isn't just about individual prejudice, but about systems and institutions that are built on racist ideas. It tells us that the way we remember history matters, that who gets celebrated and who gets forgotten reveals a lot about what we value as a society, that challenging official narratives is important and necessary. It tells us that the problems of the past aren't really past, that the attitudes and beliefs that allowed Sims to torture enslaved women are still affecting healthcare today, that we can't fix current problems without understanding their historical roots. And it tells us that everyone deserves to be treated as fully human, that no one's suffering should be dismissed or ignored, that medical care should be based on consent and respect, not exploitation and force. James Marion Sims died in 1883. He was buried with honors. His obituaries praised his contributions to medicine. His legacy was secure. ANARCHA, BETSEY, and Lucy died at unknown times and unknown places. For over a century, their names were barely remembered. Their suffering was a footnote at best. But now, we're starting to tell a different story. We're saying their names. We're acknowledging what they went through. We're recognizing that they were the ones who really made the medical advances possible. This is just the beginning. There's still so much work to do, so much history to uncover, so many wrongs to address, so many systems to change. But it starts with knowing the truth, with refusing to accept simplified hero narratives, with insisting that everyone's humanity be recognized. James Marion Sims was not a hero. He was a man who tortured women in the name of medical progress. And the women he tortured, ANARCHA, Betsey, and Lucy, deserve to be remembered and honored for what they endured. That's the real story. That's the truth we need to face. And once we face it, we can start to build a better, more just medical system that truly serves everyone. Subscribe if you want to see more stories that challenge what you thought you knew about Black history.